When you walk into a clinic or a hospital, you've got certain expectations, right? You expect to be taken care of. But what if, what if the care you got was totally different from the person sitting right next to you just because of who you are? Yeah, that's what we're going to dig into today. It's a complex reality, and we need to understand it. So it all boils down to this one huge question. Is healthcare really the same for everybody? And, well, when you look at the evidence, the answer is a pretty clear no. Not even close. All right, so let's get on the same page. To really get into this, we have to define our terms. What in the world are health disparities anyway? Okay, at its core, it's pretty straightforward. Healthcare disparities are just differences in the healthcare that different groups of people get. And it's really important to get this. We're not talking about personal choices here. This is about systemic, built-in differences in the care itself. And this is where it gets real. You can see the impact clear as day. When you compare vulnerable groups to the general population, you see they're often dealing with more risk factors and, at the same time, have way less access to care. The result? It's not just some small gap. We're talking about a serious disadvantage that can literally lead to more sickness and even higher death rates. Okay, so we know what these disparities are. The next big question is, who are we talking about? Who's actually being affected by this? Well, the answer is, it's a whole lot of different people. We're talking about minority groups, folks who don't have insurance, people experiencing homelessness, members of the LGBTQIA community, and the list goes on. This is not some small niche problem. It touches pretty much every corner of our society. But just listing off groups doesn't really do it justice, To really get the full picture, the full weight of this, we've got to look at the specific real-world barriers these communities are up against every single day. All right, first up, let's take a look at the LGBTQIA community. For them, a lot of the challenges are tied up in social dynamics and, frankly, in fear. You can literally draw a straight line from a feeling, like the fear of being judged or stigmatized, to some really serious health impacts. That fear, it can make someone avoid the doctor altogether, and that leads to very real consequences, like missing crucial cancer screenings and, tragically, higher rates of depression and suicide. And this quote right here, it adds a whole other layer to the story. It shows that these disparities don't just happen inside a clinic. The lack of traditional family support systems can create huge, huge problems down the road, especially when we're talking about care for the elderly or for people with disabilities. Okay, let's shift gears to another group, people experiencing homelessness. Here, the barriers they face are often incredibly immediate and tied directly to their environment. And the connection is it's brutally direct. Think about it. Unsanitary living conditions, being exposed to extreme weather, that leads straight to things like malnutrition and a much higher risk for infectious diseases. We're talking TB, pneumonia. And when they do finally make it to a hospital, they often have to stay longer and, sadly, have worse outcomes. This next part is it's absolutely heartbreaking. It shows that these disparities are quite literally a matter of life and death, right from the very start. An infant's chance of just surviving can be cut down drastically simply because of the situation they're born into. It's devastating. And for our last example, let's talk about minority groups. Here, the disparities are often wrapped up in big systemic problems, like access to health insurance and, believe it or not, simple communication. So you can see how something like not having health insurance or facing a language barrier directly leads to poorer health. It's a domino effect. It results in higher rates of chronic diseases, diabetes, hypertension, heart disease, often because people wait to get help until a small problem has blown up into a full-blown crisis. And isn't that incredible? Something as basic as a conversation can turn into this massive roadblock. If a doctor or a nurse and their patient can't understand each other, it can just undermine the entire process. I mean, everything from getting the right diagnosis to following the treatment plan. Okay, so we've spent a lot of time on the problem, and it's a big one. But let's talk about solutions. Who's actually doing something about this? Well, right on the front lines, you have nurses, and they have some really smart strategies for bridging these gaps. And their approach it's so powerful because it's so simple. Step 1, start with a nonjudgmental attitude. That's how you build trust. Step 2, Focus on the symptoms first. What's the immediate problem that brought the person in today? That shows you're listening. And only after that do you start to plan for ongoing long-term care. But how do they do that, really? How do nurses build that trust right out of the gate and get a real understanding of what a patient's life is actually like, what they truly need, especially when that person comes from a vulnerable group? It comes down to asking the right questions. We're talking about questions that show genuine respect, that show you want to understand the whole person, not just a list of symptoms. Simple things, right? What name would you like us to use? Is there a specific gender you identify with? Do you feel safe at home? These questions, they go so far beyond a medical chart. They build a human connection. All right, so we've defined the problem, we've looked at some tough examples, and we've seen how people on the front lines are trying to make things better. But you might be thinking, why does this matter to me if I'm not in one of these groups? That's a fair question. Here's why. Because fixing these disparities, it's not just about helping one specific group. It's about making the entire healthcare system better for all of us. When we build a system that's grounded in respect for the individual, that understands cultural differences, and that makes us aware of our own biases, well, that's a system that delivers higher quality care for every single person who walks through the door. So, I want to leave you with one final thought to chew on. Just look around your own community, your town, your city. What do you think is the single biggest barrier to health equity right where you live? Because just thinking about that question, answering it for yourself, that's the very first step toward building something better for all of us.